Dave Farnbaugh from Sweeney Law Firm joins us with an update on the epidemic of medical errors. So it is widespread.
Well, unfortunately, Dirk, there's a lot more data that is coming out now. The estimates now, the most recent studies that I've seen, they're estimating anywhere between 250,000 and 440,000 per year deaths in the United States from medical malpractice. It's the third leading cause of death in the United States behind cancer and heart disease. And that would just be the fatalities. Sort of an old adage in my business is for every 10, for every medical malpractice case that's brought, there are 10 that are never brought because the patient doesn't know or chooses not to bring a case or whatever. So that'll give you some idea of the scope of the problem. It's a serious public health problem.
What do you think, or how do you think the law will change, or will it change at all as we get a new administration in? Are they going to be more friendly to patients or to doctors? What way the pendulum's swinging?
Well, it's looking like I read that the new HHS secretary that's been nominated by President-elect Trump, his name is Mr. Price, and sort of his background is obviously anti-Obamacare, and also when he was in the Georgia legislature, he kind of pushed for medical malpractice tort reform. So the trial lawyers are sort of anticipating that the new administration is going to propose medical malpractice tort reform measures.
So when we say tort reform, does that make it more easy or more difficult if I'm a patient and I've been a victim of medical malpractice? What exactly does that mean?
Well, tort reform, Dirk, would mean, for example, the tort reform measures that we have in Indiana are caps on damages and a system where we have medical review panels. So usually tort reform means trying to curtail the rights of consumers to bring a legal case or cap the amount of money that can be recovered.
So anything that we can do as patients to prevent this? Is there steps we can take, common sense measures?
Yeah, I think, Dirk, the most important thing that people can do with these statistics about what a public health problem medical malpractice is to always proactively take steps to protect yourself. The most important things that you can do as a consumer are to obviously research the doctor and the hospital that you're going to have a procedure with. You should always get a second opinion. You should feel free to communicate with your doctor. I think too many times patients regard doctors as sort of authority figures that you can't question their plan of action with regard to your care, and you have to feel like you can communicate and ask the tough questions. And too many people don't do that. And another thing, a simple thing that you can do, is a lot of people have the misconception that with this new online or computerized medical records that doctors communicate with one another, and I'm here to tell you, as a lawyer that does medical malpractice, they don't. So I always tell people to get a hard copy of all your records, put it in a binder, and take those records with you to appointments so that all your doctors will see what your other specialists are doing to treat you.
Yeah, I mean, again, you're right. I just assumed that, okay, it's digital, so they're all looking it up on the same hard drive in the cloud somewhere.
Right. Not true.
Not true at all. All right, if somebody feels like they have been the victim of a medical error like this, do they have a certain length of time to reach out and contact you?
In general, Dirk, it's 2 years, but certainly if you're the victim of medical malpractice, don't wait 2 years to call a law firm like ours, Sweeney Law Firm. We offer free consultation. We don't charge anything unless we make a recovery. So there's really no risk to investigating a medical malpractice claim.
There you go. If you'd like to find out more, you can find them online at SweeneyLawFirm.com. You can give them a call as well at the number 420-3137, 260-420-3137. We'll be right back on Insight.